Hi, this is Dr. Kaan at the ACL Academy, and today I want to go over a little tip or trick that I like to use for people that are experiencing a little bit of anterior or front knee discomfort when they're going to start their workout. Before I get further into that, guys, if you've been following along, please and subscribe to the channel. If you have questions, comments, drop them below, and more importantly, share with a fellow ACLer that can benefit from these tips and education. We put out a new video every single week. So, front knee pain. This is an area where a lot of people going through ACL recovery can experience some discomfort at a certain point in the process. And one of the reasons is being, regardless of your graft, what they use to replace your ACL with, we are very heavy on the quads. So sometimes the tendons can get overworked, and this can cause a little bit of discomfort in that front area. But those of us who got a patella tendon graft or a quad tendon graft where they remove a piece of that tissue, well, that tissue scars down. And what can happen is, due to the lack of blood flow, as those tissues are healing and getting stronger, this can lead to some discomfort, especially during the beginning of a workout where we're not as warmed up, right? So biggest complaint that I get is, hey, Kaan, I go to start my workout and the first sets are always tough, because it just hurts me or bothers me. And then as I feel like I get going, I'm able to push more weight or I'm able to do more. So I'm going to show you a little bit of a tip that you can utilize and try as more of a warm-up before you get into your workout. And one thing that I really like to use is what we call an isometric contraction. Basically, it's contracting that quad muscle without necessarily moving it. So the muscles are not going to lengthen or shorten, and we're going to put some force through the muscle, also through the tendon, load the joint, and bring more blood flow to that area early on. So this way you can get into your workout. So for example, if you're normally used to going into the gym, getting warmed up on a bike or an elliptical, and then jumping into your workout routine, and then just trying to get through those first couple sets, well, here's something that you could try. I'm going to show you a few different versions. You'll see what can work best. These are super, super safe, especially if you're already in a gym routine and you're doing some strength work. You can incorporate this before you get into your actual programming. So let's say you get off your bike or elliptical. First version I'm going to show you is just a seated position. You could do this on a bench, but you probably easier to do just even on a leg extension machine. So you hop in there, you get under the bolsters, and I'm going to use my one of the legs as a bolster. If you're not in a leg extension machine, you could do this just on a bench. Let's say my left leg is the involved leg. My right leg is going to go right over it. And basically, I'm going to contract this muscle, pushing in to the bolster or my leg, whatever is there, and we're going to hold anywhere from 20 to 45 seconds. So get a good hold, good contraction. You're going to get the muscle working, you're going to get the tendon loaded, you're going to put some pressure on the front of the knee joint to really bring some blood flow there. And you would do 2 to 3 sets here. The other angle that I like it at is just a little higher at 60 degrees. So same thing, I'm pushing in. You could start with a light contraction and build your way up. And for you, you could play with different angles, and preferably you want to pick an angle that you kind of feel bothersome, like you feel a little discomfort, a little achiness, little pain there. So this way you're really working that area. And again, you start with light contraction and you're pushing more and more and more pressure in. And you do 2 to 3 sets just like that. And that would be potentially the warm-up. And then you would jump into your exercises. A couple other positions that you could try. Standing position, right? So if I'm standing here, I can get into a single leg stance. And what I would do is, if I want to load the quad a little bit, is I'm going to let my knee drive forward, put a little bend in my knee. So this gives me a single leg stance, but my knee is forward. So if you see me from the side angle, I come up onto that leg, and then I bend and I drive forward here. Okay, so we do the same thing here. You can do a contraction anywhere from 20 to 45 seconds, really put some load on the quad, put some pressure on the front of the knee joint, the tendons, bring more and more blood flow there. And we can do 2 to 3 sets here. So you can do the first version on the knee extension machine, or even on a table where your leg is providing the block. Second position is a single leg stance. You could use something to hold on to if you feel like you're losing your balance. But the most important piece of this is you want the knee to drive forward. Okay, so I'm going to almost if I'm looking down at my toes should disappear. My knee should make my toe disappear. And then I'm going to load here, do the same hold. Okay, so that's the second version. And if you want to get a little bit more aggressive, you could try what we call like a sissy squat hold. So this really looks like shoulder width apart, and instead of just coming onto a knees bent position, we're going to come up onto our toes, and then we're going to let our knees dive forward. I would use something to hold on to, like either a bench, or I'm using a dowel here, and we are putting a lot of pressure, a lot of contraction, force from our hip flexors to our quads, all the way through to our knees, really loading the knees and bringing some blood flow there. And you would do this similarly how we did before. 3 sets, 20 to 45 seconds. Bring some blood flow to that area, the quad, the quadricep muscle, quad tendon, the patella tendon, put more force on the anterior part of the joint. So it's a very easy but solid contraction that brings good blood flow to that area. And it'll help, right? So you can get right into your workout routine there. So I like to utilize this, especially for people that, again, complain about some anterior knee pain, right? It's kind of a global. Sometimes it could be specific to patella tendon or the quad tendon. Sometimes it could just be kind of surrounding the kneecap itself. So a good way, so we can still continue our workouts, still continue to move some weight, is get that contraction going, bring some blood flow early, right? So right after our, let's say, our bike or elliptical routine, and this way we can get right into our workout there. Hope that makes sense, guys, and give you some tips. Try the different positions, see what works best for you. If you have questions or comments, drop them below. Again, if you find value here, please subscribe to the channel. Please like the video. More importantly, share with a fellow ACLer that can benefit from these tips and education. We put out a new video each and every week. This is Dr. Kaan, signing off.